Hi, thank you everyone for joining. I'm Joe Gennaro, CTO of Curatix, which is a New Haven-based Yale spin-out out of the Shukri Bemamoon lab here at Yale. We've assembled a team of scientists, entrepreneurs, and advisors, including doctors, and thank you, James and John from Yale Ventures for supporting us. Our mission is to develop more effective and safer antimicrobial therapies and advanced diagnostics. And we just got underway in April in biolabs on West Campus. We're supported by the NIH and our Phase 1 SBR grant. And antimicrobial resistance is an urgent global threat. In 2019, nearly 1.3 million deaths were attributable to it. By 2050, this number will grow to 10 million if we don't change our strategy. And we currently spend almost $14 billion a year on this threat. Now, this is a large, multifaceted problem, and we have a pipeline of projects, of two of which we'd love to share. They are pretty topical. You may have heard of both of them. Candida auris is a fungal pathogen, which was announced in March by the CDC to be an urgent threat because it's growing very quickly, almost 200% a year since 2016. And some of the cases are resistant to all known antifungals. So it's not yet Last of Us territory, but where are we headed with this? Babesiosis is a Lyme co-infection. It's a tick-borne disease. Like other in this category, 90% of cases go undiagnosed. And Connecticut is high on the list of growth since 2011. In some states, it's over 1,000%. And the CDC has noted for both of these, there's increasing incidence, ineffective treatments, and we need better diagnostics. So in the case of antifungals, we have the PAMS project, Potentiators of Antimicrobial Susceptibility. Now, the studies of fungal biology revealed if you destabilize the detoxification pathways against clinically used antifungal drugs, you potentiate their efficacy. So in vitro and in vivo, we've shown a protective effect for mice, and we consider this to have broad implications, not just for fungal infections, but also for antibacterials and antiparasitics. We're very excited about this project. And in the case of Babesia, studies into the proteins they secrete while hidden inside of red blood cells in your blood revealed a new form of diagnostic, which is very sensitive. It can detect in hemolysis or in whole blood at levels 10 to 20 times lower than what would be symptomatic. So this would enable a rapid diagnostic, a point-of-care test. You could use it as a prophylactic. Remember, the turning point of the COVID pandemic for our lives is when we could go visit, then get a at-home assay and determine we're not a threat to the people we care about. So we're very excited about this test, and we're launching it with the Yale Pathology Core in a CLIA-approved lab, and we anticipate setting up a service-based multiplex diagnostic here. And in both cases, these came out of basic research, but they've been vetted and they're getting funding in their own merits. And in the case of antifungals, we have a paper in Structure last year. This is high-resolution crystal structure of the target enzyme of the first class of PAMS compounds. And we hope to have, by the end of this year, $4 million in cumulative non-dilutive funding. And this is protected by Yale IP. In the case of Babesia, in April, we were on the cover of Nature. This is a life cycle of the parasite, little alien getting ready to bust out of the red blood cell. And here we're in Lyme Diagnostics, we're in negotiations for $2 million of a mix of dilutive and non-dilutive funding, again, protected by Yale IP. And this is just two of the projects we have. We consider ourselves a platform company. We want to take academic projects and de-risk them into commercial products, starting with non-dilutive funding. And we're looking for partners all along this value chain. And we think of this as a radical cure for the infectious disease pipeline. If you were at the VC panel earlier, you noted how quickly they were saying, well, this chain is broken. Even talent is leaving. We want to fix that. We think we have a way to do that here. So if you have any questions, please reach out to us, info@curatixbio.com. Thank you very much.